For more than 50 years, Hinton Rural Life Center has been working to make homes in our community warmer, drier, safer.
As we reflect on our history, we realize that other factors are important in addressing the housing issues as well as quality of life in general.
In 2016, Hinton partnered with the University of North Carolina, Greensboro in a quality of life study for the area of Clay and Cherokee counties in North Carolina and Towns County, Georgia. The project was led by Stephen J. Sills, Associate Professor and Director at the Center for Housing and Community Studies at UNCG.
I've done a lot of work in southern Appalachia recently, where average life expectancy is 8 years lower than the national norm, 70 years on average. What are some of the factors that we found that are associated with this quality of life difference? Importantly, housing is related to the health of the community. We find that substandard housing is correlated with several health problems and mental health issues. Asthma, for example, affects more than 10 million children in the United States, and it's been linked directly to substandard housing conditions.
We have a lot of problems here in Clay County, specifically with respiratory disease. In fact, it was the third most killer in our area for a number of years recently. So when we look at that COPD and we look at asthmatics and we're looking at everything that's associated with it, Public Health 3.0 is saying, okay, there's obviously something going on within our buildings. Let's look at putting in new air filters into homes. Let's look at changing out carpets for something that can be clean and can be allergen free. And it's taking a very different approach instead of the Band-Aid, oh, here's an inhaler, to what can we do to improve the area around us that can lessen that burden of chronic disease down the road.
Hinton receives 200 requests for home repair or help every year. And in those requests, it's then our duty to go out and assess the sites completely. So we've got kind of a short list of what people have asked us to take care of, things they were concerned about. And some of them are legitimate and some of them are just kind of, not as important as other details we wind up finding in the home doing our Safe and Healthy Homes checklist. It's a long list, couple of pages that covers everything from standing water in a room to whether the windows and doors are able to shut all the way.
This map shows us 6,200 cases from one quarter of 2016 from the local emergency department and health clinics, people reporting for respiratory illnesses and asthma. It shows us a hotspot map very similar to what we saw with substandard housing. Asthma cases are concentrated in low-income communities with substandard housing and little available health care.
Another problem that we're looking at with substandard housing and chronic disease would be water intrusion and dampness overall, because that would cause mold growth. And then when we're looking at mold growth, we're looking at problems with other respiratory diseases, which for the kids specifically could lead to more days out of school and the less likelihood of them getting the full education that they need in order to have proper health-seeking behaviors.
To give you an example of something that could happen, as simple as the toilet seal at the base of the toilet, there's a wax ring that basically keeps all the fluid in the passageway it needs to be in. And just from normal use and wear and tear, sitting and standing and tweaking the toilet, it can develop a small leak in almost no time. In a couple months' time of an ongoing leak right there, you'll severely affect the subfloor around the toilet, making it weak and could even possibly come through the floor. In most situations when we're doing a subfloor replacement, the old subfloor is made out of a old product that just is not resilient. And we choose to use a weatherproofed, hardier material that will stand up to future abuse. Even though it's more expensive, we realize that the potential is there for water to hit the floor. So we need a product that is going to last and be resilient for the future.
Since the quality of life study, we have a better understanding of our community. We also understand the social determinants of health and how they impact our services. In order to make an impact, we need to look at the broader picture. And so we launched the Council for Collaborative Impact. It includes professionals and retirees and just people from the community. The Council for Collaborative Impact focuses on gaps in our community, including economic development, technology, education, children's needs, substance use and mental health, housing, and transportation. By working together and sharing information and knowledge, we are able to serve our community more efficiently and effectively. We're able to share training costs and travel to different locations to see best practices in action. Through an upstreaming approach, we will work to address the gaps in our community. While doing so, we will continue to focus on substandard housing, particularly on the non-medical drivers that impact health. And through our home repair ministry and educational initiatives, we will work to improve the quality of life in our community.